What are goblet cells in chronic bronchitis? Have you ever wondered what goblet cells are and how they relate to chronic bronchitis? These specialized cells play a significant role in the airways, especially for those dealing with chronic bronchitis, a form of chronic obstructive pulmonary disease. Goblet cells are found in the lining of your airways and are responsible for producing and secreting mucus. In chronic bronchitis, the number of goblet cells increases, a condition known as goblet cell hyperplasia. This increase leads to an excessive amount of mucus in the bronchial tubes. Normally, goblet cells help trap dust, microbes, and other particles, protecting your lungs. However, when the airways are repeatedly irritated, often due to smoking or pollution, the lining of the airways changes. This irritation causes more goblet cells to form, which results in an abnormal production of mucus. The excess mucus becomes thick, making it difficult to clear through coughing. This contributes to the airway obstruction and breathing difficulties that are common in chronic obstructive pulmonary disease. In addition to goblet cell hyperplasia, chronic bronchitis may involve other changes in the airways. These include squamous metaplasia, where normal airway cells are replaced by squamous cells, and basal cell hyperplasia. There is also dysfunction of the cilia, which are tiny hair-like structures that help move mucus out of the lungs. When cilia are impaired, it worsens the problem of mucus clearance. The mucus produced by goblet cells in chronic bronchitis contains specific proteins known as mucins, primarily MUC5B and MUC5AC. In patients with chronic obstructive pulmonary disease, MUC5B is usually more abundant, contributing to the thick and sticky mucus often seen in chronic bronchitis. This overproduction of mucus, along with the difficulty in clearing it, leads to chronic cough and sputum production, which are hallmark symptoms of the condition. Active smoking is a major factor that drives goblet cell hyperplasia and mucus overproduction. Smoking causes inflammation in the airways and changes in the epithelial cells, promoting the differentiation of goblet cells and increasing mucus secretion. Even individuals who smoke but do not have airflow obstruction can show increased goblet cell density. However, this increase is more pronounced in those with chronic bronchitis and chronic obstructive pulmonary disease. In summary, goblet cells in chronic bronchitis are specialized cells that produce mucus. Their number and activity increase due to airway irritation and inflammation, leading to excessive mucus production. This excess mucus contributes to airway obstruction and respiratory symptoms in chronic obstructive pulmonary disease. Effective management of chronic bronchitis often includes strategies to reduce mucus production and improve clearance, along with smoking cessation to prevent further damage to the airways.